Hi, Dr. Cowan.
Hey.
I'm glad we have this opportunity to talk about TMS today.
Yes.
So can you share why we felt TMS was a good opportunity for us to do in our office?
Absolutely. You know, we were so excited to have TMS come to San Antonio. And TMS, of course, is an FDA-approved treatment for depression. And now we've been doing TMS for several years, over 4 years now, and have treated many, many patients. And I think what's most exciting is that we finally have a treatment option that produces wellness. Our response and remission rates have been incredible. You know, over 75% of patients improve and no longer have symptoms of depression, which is very exciting. And I think that was our goal in bringing TMS to San Antonio. Wouldn't you say?
Definitely. And when you're deciding if someone is a candidate for TMS,
Yes.
What are some of the factors that you consider before you offer TMS as an option?
I think of any patient that's ever had problems at all with medication, tolerating medication, if they have side effects to medication, if they have medical conditions, let's say, that might be complicated, or if they plan on getting pregnant maybe and don't want to take medications during pregnancy. I think TMS is an excellent treatment option for depression.
So Dr. Cowan, how can you summarize how TMS actually works on the brain?
Sure. So TMS is a magnet. It's just like an MRI magnet, and basically it's connected to a computer, and we use that magnet to stimulate that left prefrontal cortex in the brain. The setup is much like a dentist chair, where a patient is very comfortable in a reclining position, and the magnet we set on that left prefrontal cortex, and the treatment lasts about 35 minutes. The magnet turns off and on very quickly, and that changes blood flow into the brain and stimulates chemical changes that happen in the brain.
Right. And in my experience, many patients have been able to come off of their medication or even reduce their dosages, which also makes for a better quality of life.
I totally agree with you.
Many of our patients suffer from a lot of side effects that are really intolerable, excessive weight gain, trouble sleeping, low energy, difficulty concentrating. What are some of the improvements in the symptoms that you have seen in your patients when they're doing TMS?
I see most often people describe feeling lighter in the beginning. After a few treatments with TMS, they feel like they have more energy, they don't feel as fatigued, they concentrate better, they get out of bed more easily, they get ready for work. That's what they describe early on with TMS. And as the treatments progress, other things improve too, like sleep quality, overall appetite usually regulates. And for a lot of people who are depressed, they tend to overeat and they gain weight. And so it's so nice with TMS as you see people have more energy, they want to exercise, they want to work on the weight, get some of the weight off. And that's really exciting to see when people start feeling better and starting to feel well again and more hopeful.
I've seen many patients too who've been on many medications or many years of depression. I've also seen patients who've had their first depressed episode and only been on one medication, and they equally across the board seem to have an incredible response. So I'm really happy we're able to share this treatment option for our patients, because it's not good enough for me anymore for them to just get better. I want them to not feel depressed anymore.
Yeah, I totally agree with you. That's the thing I think that's exciting about having this option now. Is, you know, for so many years we've only had medications, or maybe something like ECT, electroconvulsive therapy. And I agree with you 100%. The goal of treatment now is for patients to be well.
I also really like the unique setting that we offer our patients here, where we have the collaboration between me and you and Dr. Campos, and we can combine our specialties. And we also, really our goal is wellness, you know, looking at the whole patient, and also bringing in treatment with therapy and cognitive therapy particularly. I think that's really important, and that's why our patients are doing so well.
So should we talk a little bit about what our specialties are, as far as like patients that you've seen in your practice?
Sure. I see mostly general adults. I see late adolescents as well.
Okay.
In TMS, I've particularly had very good success with patients who had depression with PTSD or patients who are pregnant.
Okay.
I've also had some patients who describe a lot of anxiety, a lot of difficulty settling down, insomnia, restlessness, racing thoughts. And so I think it's important for us to look at patients who are not just depressed, but may also
Yes.
have other comorbidities when they come to us, because those patients can also have a very good success rate. Have you treated any of your geriatric patients with TMS?
I have, yes, and it's a nice treatment option because my specialty is the older patient. So I see adults, general adult patients as well, but then I have an interest in the geriatric population. And what I find is, and of course, that's anyone over the age of 65. So what often we see is people who have other medical problems. And those folks really can't tolerate medications often. And so that's why TMS has been such a great option.
And we collaborate a lot with other specialties, so we do get referrals a lot from outside our practice.